Does scoliosis cause back pain? This is such an important and common question. And like the answers to many good questions, the answer to this one is a little layered, a little nuanced. The short answer is no. Scoliosis doesn't in and of itself cause back pain. Scoliosis refers to a curvature of the spine. That curve can be a C curve or an S curve. Some curves are very mild, some are quite severe. But the curve in and of itself isn't painful. Now, with that said, the curve presents a mechanical disadvantage to the spine, and this mechanical challenge can certainly lead to a variety of problems. Hello, my name is Dr. Grant Cooper. I'm the co-founder and the co-director of Princeton Spine and Joint Center. The mechanical disadvantage of scoliosis puts extra pressure on parts of the spine that might not be designed to face those increased pressures. As a result, there may be more breakdown. There's certainly more of a risk of breakdown, degeneration, inflammation, and pain. Some common forms of this include irritation of the facet joint and wearing down of the intervertebral discs. Additionally, the sacroiliac joint, which is basically where the spine meets the pelvis and where the weight from the spine and the upper body is transferred to the lower body, is a frequent source of pain as well. Another common manifestation of issues in people with scoliosis is a radiculopathy or a pinched nerve in their back. Basically, because of the scoliosis, some of the holes where the nerves exit the spine, what we call the foramina or the foramen, are going to be smaller. And therefore, there's less room in there for the nerves. As a result of this already being a smaller hole, it's going to take less of an insult to irritate those nerves in that smaller hole. So back to the original question, does scoliosis cause back pain? No, not directly, but it certainly helps set the stage for a significant problem. Knowing this, the best thing to do if you have scoliosis but you don't have symptoms is to try and get in front of the potential problem. The best way to do that is to learn and perform a set of exercises that will help unload the spine and keep the pressure off the spine so that the spine undergoes less wear and tear. Now, to be fair, these are the types of exercises that, frankly, everyone should be doing in order to support their own spine. But if you have scoliosis, you have an extra incentive to do those sorts of exercises because, frankly, you're at an increased risk of developing back issues in the future. Of course, like you could do all of the exercises perfectly and still develop pain, and you could never do any exercises at all and just get lucky and never have pain. I had a great aunt who never smoked and died young. And her sister, my other great aunt, smoked like 2 packs of unfiltered Camels a day, and she lived into her late 80s. So that data aside, smoking is still really bad for you. Similarly, the right exercises don't guarantee a good outcome, but they definitely help stack the odds in your favor. Now, what are the right exercises in particular? Well, in essence, you want to increase flexibility in your whole spine. You want to make your spine more supple, strengthen the surrounding core and other postural muscles, strengthen the rhomboids, the hips. The best way to design a program for you is likely to work with a great physical therapist one-on-one. Another really good approach with the exercises is through a more common program like Pilates. And then there's a completely other exercise approach through something called the Shroth Method. Now, the Shroth Method was developed in the 1920s by Katharina Shroth. And the Shroth Method uses customized exercises and breathing techniques, such as breathing into the concave side of your body in order to help restore symmetry and alignment. How well the Shroth Method works depends on who you ask and where you read. It's definitely an intriguing approach, and if you have significant scoliosis and you have a Shroth Method practitioner in your area, it's certainly something that's reasonable to try. I've had patients with scoliosis who have had a wide variety of pain. For the most part, getting them better is generally just like getting anyone else better. I've had patients with extremely serious curves of more than 50 degrees who, believe it or not, have no back pain after fairly simple treatments. And I've had patients with much milder curves that sometimes are much more difficult to get better. The point is that scoliosis sets the stage for there to be a problem, but it doesn't mean that a problem has to arise, and it doesn't mean that if a problem does arise, that it can't be treated. Realistically, you want to try and prevent back pain by doing the exercises to support your spine. If pain does arise, then like anyone else, you need to identify the underlying pain generator and then address it And then on the back end, you want to make sure you have exercises so that you can support your spine so that in the future, the problem doesn't return. Thank you as always for watching this video. If you have any questions or comments, or if you have your own experiences with scoliosis that you'd like to share, we would love to hear from you. So please leave us your experiences, your thoughts, or questions in the comments section. Also, please remember to hit the like button and subscribe to our channel if you haven't already done so, so you can be sure to get all the latest information on spine and musculoskeletal issues. Thank you very much.